The Health Minister of Australia is optimistic that a safe and effective vaccine will be available in Australia early next year. Mavian Dong, who is now in Queensland, will tell us the details why live. Yes, Maeve.
Marielle, Australia's Health Minister Greg Hunt has recently updated the Parliament regarding the country's vaccine strategy. He said that Australia is on track for the first batch of COVID-19 vaccinations to be delivered in the first quarter of 2021. There are currently two lead vaccine candidates in which the federal government has invested over $1.7 billion. Those are the Oxford University's AstraZeneca vaccine and the molecular clamp being developed at the University of Queensland. The AstraZeneca vaccine, which is considered as a front-runner, is now in its late-stage Phase 3 trials. On the other hand, the University of Queensland's molecular clamp aims for approval for mid-next year. Here is what Minister Hunt said for his update to the Parliament.
In relation to the Oxford AstraZeneca vaccine, there have been very positive reports this week of strong T-cell and antibody response to the vaccine. It means that we are on track for first vaccines to be delivered in the first quarter of 2021. Equally, the results coming out of the early phase trials in relation to the molecular clamp are also very positive. That's a cause of hope for Australia, but it's a cause of hope for the world.
If proven to be successful, both vaccines will be produced by Australia's only vaccine manufacturer, CSL. Russell Basser, the Senior Vice President of Securus, the research arm of CSL, says that a huge and important responsibility are now in their hands, but he doesn't see any politicization of the process. The Australian government assures that any vaccine candidates will have to pass the assessment and approval process of the Therapeutic Goods Administration. Back to you, Marielle.
Maeve, can you please tell us who will be prioritized to receive the vaccine?
Marielle, Australia's priority list includes older Australians as they are more vulnerable, also the health and aged care workers, and also Indigenous Australians. But there are also different attitudes that can be seen in Australia towards COVID-19 vaccinations despite the country's unprecedented surge. A survey of 2,000 people conducted by Vox Pop Labs for ABC showed that 40% believe that the COVID-19 vaccine will be very safe when it becomes available, while 30% said mostly safe and 17% responded with somewhat safe. Aside from this, 64% said they are very likely to get the vaccine, while 12% said they are either very unlikely or somewhat likely. Marielle?
Thank you, Mavian Dog, for those updates on Australia's vaccine candidates, live from Queensland.